Hey, Jimmy Nicholas here, and today I have a very special guest, Paul Costa from Stagecoach Insurance. Now, I've been getting so many inquiries about Medicare and all the changes that are going on out there, so I've got some questions, top questions that I've been asked over and over again, and I wanted to bring you in, Paul, to answer these questions. Now, a lot of people, they've heard of Medicare, they know about Medicare, but could you go a little bit deeper, for everybody out there?
Jimmy, thanks for having me. I appreciate you taking a few minutes of your time to ask me. And yeah, everybody kind of questions Medicare. Everybody knows that, hey, when I turn 65, I can get my Social Security check and I'm on Medicare. But what they don't realize is that Medicare is actually set up in different programs. There's Medicare A, Part A, which is the hospital, and Part B, which covers your doctors and outpatients. But we also have Part C and Part D. And it gets really confusing if you look at all the ads. People don't understand what they're getting into. But the nice thing is that whether you're in just original Medicare is what A and B is called, or Part C, you never really leave Medicare. So it makes it nice and safe whatever type of program you decide to go with. Medicare works real well.
Now does Medicare cover long-term care?
Yeah, no, it doesn't. It'll cover specialty care, like you're in the hospital, let's say you fell down, you broke your hip, okay? The doctor says, hey, look, you don't need to be in the hospital anymore, but you need more care before you can go home. They'll go ahead and put you in a facility that's designed for short-term rehabilitation care and cover it. But if you've got dementia and you're going to be in a nursing home for 3 to 4 years, no, that's not what it covers for. You have to have long-term care insurance for that.
So that's separate.
That's a completely separate animal that we need to discuss at a different time, because that's got all kinds of programs that we have to work into.
Now, I've heard Medicare Supplement and Medicare Advantage, and a lot of people, turning 65, are 65, this is a big, big topic for them.
Oh, it's a huge topic, because you really need to know what your plans are and what your goals are. A Medicare Supplement is basically, there's 4 or 5 companies that are very big in Medicare, and they specialize in supplements. And basically what the supplement does, Jimmy, is it just covers what Medicare doesn't. There's, depending on your state, anywhere from 9 to 12 plans. Okay, so it just depends. You just have to get with your local agent and figure out which plan's for you. They have some, like Plan F, basically for every state, is the Cadillac. It covers everything. You pay your premium and you never pay another bill. Okay, and then they have some where you pay the premium and you have big deductibles, and then over a certain amount of dollars you get everything paid for. But the premium is a lot lower. So it just depends on what you want to do. If you're a traveler, a Medicare Advantage supplement plan is definitely good for you, because as long as the hospital takes Medicare, whether you're in California, whether you're in Connecticut, whether you're in Alabama, you're done. You don't have to worry about it. Medicare Advantage plans, the federal government pays for the plan. You're still part of Medicare, so you don't have to worry about leaving. That's Medicare Part C, okay? The Advantage plans, they're like basically glorified HMOs, just like you had when you worked for your employer. You had the HMO, you had to go to this hospital, this doctor, this area, and if you went out of the area, you have to make sure that that hospital or plan is in there. But if you're traveling and you're sick and you need to go to an emergency room, they'll cover it just like if you were local. So it depends on what you do. So when you're sitting down talking to your insurance consultant, you need to put these things in. And I'll give you an example like my uncle. They never leave their house. They don't go anywhere other than a grocery store. They don't ever go out to eat. So they live in Connecticut. They never leave Connecticut. An Advantage plan is perfect for them. Gotcha. My in-laws, they're never home. They're gone all the time. They have supplements. They have the F plan. It doesn't matter whether they're in Kentucky, whether they're in California, whether they're in Alaska, whether they're in Hawaii. Boom, they don't want to get sick, they're covered. No questions asked.
So how do you pick a plan like this?
Yeah, again, you really have to sit down with your insurance person. That's one of the mistakes that people make. When I have my seminars, I get people to come in and we start talking about this, and they say, oh yeah, I'm on this Medicare Advantage plan, and I live 6 months here and 6 months in Michigan. I went in the hospital and it wasn't covered. Well, that's not what that plan's for. You're supposed to be a resident of the state and the area, and you need to make sure that the plan you're in has a program that works there as well. So you need to know these things. It's not just a matter of, I'll take this one because somebody else is paying the bill for you. It might not fit what you're doing. Where the Medicare Advantage plan, like I said, that they're great. My father has one. He doesn't go anywhere. He stays home.
Gotcha.
So there's 2 hospitals within 4 miles of his house. Both of them are on him. All his doctors are on him. He ain't going anywhere. They cover his prescriptions. They cover everything. It's perfect for him.
Gotcha. Now, you've probably seen in the papers, I've been seeing this donut hole. What is that all about?
Oh, that's when they made Medicare Plan D to cover prescriptions. Basically, I'm going to give you the short thing, and I've actually pulled some information that we'll read just so that everybody gets an idea. But the whole idea behind it is that we're going to cover prescription drugs for people. And the prescription Part D, depending on which program you go with, there's a bunch of programs out there, they can have a deductible up to $345. So you pay that first, and then the plan goes up to roughly around $2,900, $3,000 and some change, which is split between you and the insurance company. Everybody pays their thing. Well, after that, until another $3,700 out of your pocket, you're on your own. And then you get into the catastrophic plan. Well, the only problem with that is that when they kind of figured this out, they didn't really spend a whole lot of time in what costs are to prescription drugs. If you've got a person who's on a lot of drugs, and again, you and I have talked about this, I use my dad. So, I mean, when his pills are out on this table, there ain't no top. I mean, he's got hundreds of them. When you look at his prescription plans, he's $1,500 a month in prescription drug costs. So he hits this donut hole like that, and then pays the rest, and then he's on the catastrophic after that. But that was one of the reasons we moved him from where he was into a Medicare Advantage plan. It helps with the prescription costs. And not only that, it helps manage more. My father's 86. Some days he takes 2 blood pressure pills at the same time instead of only 1. So it kind of helps, it works. But the donut hole is a real big issue. And again, you need to sit down and consult with your insurance person on your prescription drugs. If you take some blood pressure pills and that's all you're taking, it's no big deal. You get this, you pay your monthly premium depending on which plan you go with, you pay the deductible, it's not a big deal. But if you're on a ton of drugs and your drug bills are expensive, you need to make sure this plan fits, another plan works, or you need to make sure that there's another government program that'll work with that to help cover those costs. It's a big issue. And you need to sit down and have an honest discussion with your insurance person to make sure you're doing it right.
It sounds like it, because there's just so many different plans out there.
Prescriptions are expensive. I mean, my father takes this little thing for his eyes. They're $166. And that's every month just for his eyes.
Wow.
It's out there. You have to just take a few minutes. And if you're concerned, maybe have one of your relatives, your daughter, your son, or someone sit with you. If they don't live close by, if your insurance person doesn't want to do a conference call with you, you want to find somebody else who's going to talk to you, because they need to understand this. They need to send it to your family member first with all the stuff highlighted, and then when we have the conversation, everybody can follow along to make sure it's the right thing for you.
Gotcha.
And it's important.
Does Medicare cover burial expenses?
A lot of people think they do, and they don't. There's $255 or give or take, it changes all the time. But basically, when someone who's on Social Security passes away, the federal government gives you a check for $255 and says, have a great time. And now I don't know, but that ain't going to bury anybody. That ain't going to cremate anybody. That ain't going to do anything. So again, it's important to know these things, have a general idea, whether you buy a prepaid plan or whether you get a final expense plan. A lot of my clients have final expense plans for that simple reason. 10, 15, 20,000 bucks. Bills are paid. Mama doesn't have to worry about it. Kids don't have to worry about it. It's all done. But no, Medicare is not going to pay for your burial, so it's another thing you need to discuss with everybody.
Gotcha. Now, Paul, how can people get in touch with you if they want to talk to you about this in more detail?
Real easy. You can call me on my cell if you like, which is 941-716-2597. Or you can go to stagecoachinsurance.com. There is a contact us page right there. You can send me an email. Again, my phone number is on there, and that's the easiest way. And if you do contact me either way, I will call you back. Okay, I don't have a whole lot of employees that are receptionists that call and ask you a lot of questions. You call me, you're going to get me. So
awesome. Well, thank you for taking some time today.
Thank you for having me on. I appreciate it. If I can help, feel free to give me a call.
Thanks a lot.